Everybody knows about Botox. Not many know what Dysport is, and we are fortunate today to be sponsored by Dysport. Dysport and Botox are essentially the same thing. It is a medication that can be injected into the facial muscles to minimize movement of that facial muscle. And as you minimize the movement of the facial muscle, then the wrinkling associated with it, such as frowning, stops. And if you can't create that wrinkle, then the line that you may have even when you're not frowning corrects itself. Depending upon how deep that wrinkle is, perhaps Botox or Dysport alone would not be sufficient, in which case you may have to go to a soft tissue filler. Botox and Dysport last about 3 or 4 months per treatment. So if you like the effect, you need to be keeping up with it on an every 3 to 4 months. The most common places for these to be injected are in the number 11s, as they're called, right in between the brow or around the eye. It can be used for brow lifting, even across the forehead. Soft tissue fillers, pretty common names are Juvederm and Restylane. Restylane and Juvederm are essentially made out of a similar product called hyaluronic acid, which is a sugar molecule that we commonly find even naturally within our own body. It's created into a gel, and that gel is then injected into commonly the nasolabial folds or the parenthesis lines. It could also be injected into the lips to give a fuller effect to the lip. Radiesse is another product that I like a lot that has some calcium product or particles in it. Radiesse is really more, in my opinion, for structural change. It can be injected into the cheek area to give a more pronounced cheek. It can even be injected along the jawline to give a more pronounced jaw or chin. Sculptra is essentially an absorbable product that is very similar to a suture material that we use in surgery. We inject that product suspended in saline throughout the face. So Sculptra essentially allowed us to start looking at the face more volumetrically, more spatially, rather than just in pinpoint areas of where the volume deficiency is. Meaning, when someone comes up to me and says, "I don't like this," I don't just look at their nasolabial fold, because the reason why this has become more pronounced is because the cheeks have started to descend. The volume even in the temples has started to give way, and that's brought in their face a little bit. And of course the jowling coming down as well. So with Sculptra, we are actually injecting all in those areas, in the temples, along the cheeks, along the jawline as well, and in the same nasolabial fold and marionette line area to give significant volume expansion. Sculptra has a 2-year lasting profile. It's a little bit of a misnomer, and the reason why I say that is that there probably is some product left 2 years later. But to maintain your effect, you should have a touch-up a year later. Sculptra also is done differently in that there are sessions. So typically with Radiesse or Juvederm, it's a one-time deal. You get your injection, you see an immediate effect, a little swelling comes, a little swelling goes, and then you're done again for the 4 to 6 months or 9 months or what have you. With Sculptra, it's typically a 2, maybe 3, rarely 4 sessions. And those sessions are spaced out about 4 to 6 weeks, as it typically takes about 4 to 6 weeks to see the effect of any session with Sculptra. Again, there's really no immediate effect, or any immediate effect you see with Sculptra is typically from the salt water that's injected to suspend the product. And typically within about 24 to 48 hours, that effect goes away. Most people are very disappointed as the effect goes away. But essentially, as that product is being metabolized, then you begin to see that volume expansion.